A recent study published in Frontiers of Neurology showed that snoring could be associated with up to 46% increased risk of stroke. While this is just an association, there is a well-established increased risk of stroke in people with obstructive sleep apnea, which I often see in the hospital. In family practice, we often see even young people coming in with fatigue, low mood, poor concentration, and sometimes they actually are suffering from obstructive sleep apnea, and once that is treated, they don't need antidepressants. I feel we don't talk enough about this condition, which can pretty dramatically impact our productivity, well-being, and longevity. 1 in 4 adult Canadians are at risk of developing obstructive sleep apnea. Many young people and children can also have this condition. Timely diagnosis and treatment of obstructive sleep apnea can prevent detrimental effects such as stroke, heart attack, and even early death. Watch till the end to learn more about diagnosis, treatment, and prevention of obstructive sleep apnea. Obstructive sleep apnea happens when the tissues at the back of your throat fully or partially block your breathing. Even though you're still breathing, there is much less oxygen getting into your lungs. Sleep apnea refers to pauses that happen when you sleep. The episodes of disruptions in your sleep, called apneic episodes, can last to 10 seconds or even longer, and they lead to decreased oxygen concentration and increased carbon dioxide concentration in your blood. People who have sleep apnea could stop breathing hundreds of times through the night, and this leads to a very unrefreshing sleep. There are different types of sleep apneas, and we're going to talk about a specific type called obstructive sleep apnea. If you have this condition, you probably go through this cycle many times throughout the night. First, you sleep quietly and normally, and the air flows smoothly from your airways to the lungs. Then you begin to snore loudly. This is a sign that your airway is partly blocked. If the blockage worsens, this may affect the amount of air that can enter your lungs. Next, your airway closes off completely. No air is reaching your lungs. Your brain is telling you to breathe as normally, but you can't because your airway is closed. After a pause of about 10 seconds or more, your brain will realize that you haven't been breathing, and it will jolt you awake with this surge of catecholamines and sympathetic nervous system neurohormonal bouquet. So you take a big gasp of air and you breathe again. And you may or may not remember these episodes yourself. A lot of people live with obstructive sleep apnea and have no idea. So some of the signs and symptoms that you might have this condition include loud snoring, gasping for air in the middle of the night, daytime tiredness and sleepiness, dry mouth in the morning. Is reaching for the glass of water first thing you do? Headaches, especially morning headaches, and frequent waking through the night. Interestingly, in 2018, Statistics Canada reported that most commonly women will present to their doctor with fatigue, while males will present with more classical symptoms such as snoring and troubled breathing. The most widely accepted screening tool for obstructive sleep apnea in primary care is a questionnaire called Stop Bang. Let's go over it quickly. If you answer yes to 3 or more of these questions, talk to your primary care provider about arranging for potential sleep test. Do you snore loudly? Loud enough to be heard in another room? And louder than talking? Do you feel tired and sleepy during the day? Has anybody observed you stop breathing during the night? Do you have high blood pressure, or do you receive treatment for high blood pressure? Is your body mass index more than 35? You can Google BMI and enter your height and weight, and you'll be able to calculate this pretty easily. Is your age greater than 50? Is your neck circumference more than 40 centimeters? And finally, is your gender male? I think it is very important to talk about sleep apnea because it can increase your risk of developing very serious medical conditions, such as high blood pressure, increased risks of cardiovascular disease, increased risk of stroke, increased risk of type 2 diabetes, kidney disease, metabolic liver disease, and even erectile dysfunction. An older report from Statistics Canada from 2009 reported that people who were told by their doctor that they have sleep apnea were 2.5 more times likely to report diabetes, 1.8 times more likely to report hypertension, and 2.2 times more likely to report heart disease. Other complications, so to say, of obstructive sleep apnea include increased level of stress. So when you're waking up through the night so many times, you have heightened levels of stress hormones in your body. It worsens your memory through probably through multiple factors, but one that comes to mind logically to me is that you have a very impaired sleep, so you don't have enough opportunity for your brain to process and solidify the memories. Skin aging. You need your beauty sleep to keep your skin glowing. Relationship difficulties from either conflicts that arise when we are cranky or from your partner having to leave the room, move to another bedroom, and so on. Increased number of driving accidents. And some sources actually cite that people who have obstructive sleep apnea have 3 times more risk of developing depression. So the worse the severity of your obstructive sleep apnea, which could be mild, moderate, or severe, the higher the chance that you will develop those complications. That is why it is so important to address it as early as possible. The standard of care treatment for sleep apnea or obstructive sleep apnea is a CPAP machine. However, the severity of obstructive sleep apnea could be reduced, or some mild cases could significantly be improved with the following lifestyle changes. Weight loss, increase exercise. Even without weight loss, that was shown to help with sleep apnea. Altering sleep position to avoid sleeping on your back. So some of the patients will use the bra on their back so that it makes it uncomfortable to lie on the back. Reducing alcohol, reducing caffeine, and quitting smoking. Remember, prevention is the best medicine, and the lifestyle choices you make today will compound over days, weeks, and months into years and will determine your quality of life in the years to come. I have included some additional resources in the description of this video if you want to learn more about this condition. If you found this video helpful, please like it so that it will promote it to other people who could benefit from it. Subscribe if you want to learn more tips on health and wellness, as well as stress reduction. And again, thank you so much for watching. May you be well, and I'll see you in the next video.